Hey everybody, Travis Robbins from Robbins Rehabilitation West here again with Dan and Nick to do our segment on balance. Balance is one of the 10 tests that we are using to predict successful aging or longevity or whatever you want to call it. And yeah, this is probably the most straightforward test. It's probably maybe the easiest one that you can do at home without too much equipment. Maybe not the safest, so we'll talk about that depending on the quality of your balance. But Dan, why don't you go over what our balance movement test is all about?
So for this one, yeah, it's just single leg balance is the main test. So stand on one leg. Goal is a minute on each side. And then if you can't do that because you're too unsteady, you can do tandem stance, which is just one foot in front of the other, and try to hold that for 30 to 60 seconds. And you can get a score on that. It's not going to be as high as on single leg, but that's kind of your starting point.
Okay. And what are people supposed to have on their feet? Can they have shoes? Can they be barefoot? What's preferred or suggested?
Um, I'd say however they're comfortable. Um, yeah,
Yeah,
I don't know.
Nick,
What do
so
you think, Nick?
what do you
I
Alex?
actually like testing both. Also to just show people the difference of how their balance is with shoes versus without.
Okay, so Nick, if I did it in my shoes and my balance was much better than when I was barefoot, what information would that tell me?
It's actually tough to distinguish because the shoes will automatically make your foot a little bit wider. So it should make it and even longer than two. So you have more surface area. That being said, when you're barefoot too, uh, it doesn't mean that that part's not true, but it also might mean you really can't feel properly with your feet. Like all the toes aren't necessarily gripping right. I mean, just your foot contact may not be the best, and you may not be able to use your foot effectively, really.
Right. And we're going to stop this just like any other test. If for some reason standing on one foot causes an increase in pain, numbness, tingling, burning, then that is going to be something that we stop at. But also, this becomes a slight safety issue in that you should be doing this with something around you that you can stabilize yourself with in case you do lose your balance, and making sure the floor is clear where you're standing so that you're not misstepping and then stepping on something else. But yeah, if it is dangerous for you to do this test, then obviously you don't want to do it. But increased symptoms of any amount are going to be something that would trigger a red flag and kind of say, hey, there might be something going on here that I need to get checked out either by a doctor or a physical therapist. Common errors in execution of this movement. I don't know there's a ton of them. Can you guys think of any? I mean, it's just standing on one foot. I mean, the surface makes a difference too. So we're thinking of, most of our clinics are pretty solid surface versus like if you did this out in the grass or gravel, or certainly if you did it on sand at the beach, that's going to affect your score probably. Dan, how would varying the surface affect the score?
Yeah, you should do it on a firm surface. Balance like it's going to be progressed or more challenging on a softer surface. So do the test on a firm surface, and we could get into maybe using like a softer surface to like work on the exercise or work on your balance later.
Yeah, that's how we kind of progress the exercise commonly in physical therapy, or you can do that at home. So, Nick, why don't you go into how changing the surface can progress the exercise and make it a little bit more difficult?
Yeah, we'll do usually one of two different things. One is either right the softer surface or the angle of the surface. Um, Either one is appropriate because you have to think of, hey, unless you're walking indoors, like I mean, we're kind of talking right now, but it's like if you're walking outside, the ground's really never flat. Like it's always up and down, left, right, a little bit, depending on the surface, right? Is it wet? Is it soft? Is it has it just rained? Is it even softer than it usually is? So all of those things are different inputs basically to your nervous system, giving your body that feedback of how you need to balance on each one.
All right, so Dan talked about the scoring a little bit. We do break this up by decade. So we expect as you are younger, your balance should be better. It doesn't mean that we expect your balance to get worse as you age, but we are allowing for a little bit lower stance time if you get older. So ages 20 to 39, we expect everyone to be able to hold that for 1 minute. So stand on one foot, not lose your balance for 1 minute. That would give you a perfect score on each side. So you get 5 points for each side, total of 10 points for the test. Ages 40 to 59, is the same hold time. We expect you to be able to hold that for 1 minute in order to get a perfect score. And then as we get 60 to 79, then we're expecting 50 seconds on each side. That will get you a perfect score of 5 on each side. And then 80 plus, we go down to 40 seconds. And tandem stance, so there's going to be if you cannot safely do single limb stance, then we're going to go down to tandem stance, but obviously you cannot get the full 5 points for that score. And if you guys are listening to this, you're going to have access to this whole scoring sheet that you can kind of look through that. But as with all the other tests, it's not as important where you start. It's more important as to where you finish. So balance is a skill that can be worked on. And I think that's a concept that when we explain that to our patients, I've gotten at least kind of a funny look. It's like, well, it's my balance. I'm getting older. I know that's supposed to get worse. And we would argue against that way of thinking. It might be more difficult to have good balance as you get older for a lot of different factors that are way longer than this podcast allows for. But it doesn't mean that you can't improve it. The analogy I use is, well, how often do you work on your balance? And most patients will say, geez, I don't ever try to improve my balance or work on it. I don't know how to do that, or no one's giving me any direction. And I say, okay, did you play any instruments when you were a kid? Sure, I played the guitar. Did you stop playing that? Yeah, I kind of stopped playing it. Okay, so if you picked up a guitar now and you haven't worked on it for 10, 15, 20 years, would you expect to be very good at it? Of course, they would say, no, I'm not going to be very good at it. But if you worked on it a little bit and you practice, would some of that come back, and would your skill improve? Well, yes, that would improve. Okay, same thing with balance. It's just something that you need maybe a little bit of direction on, which Dan will get into shortly in terms of how to improve that. But before we do that, let's go over why it is important. And first, some people, this is becoming more apparent that falls issues as you get older. I noticed that my patients are having more awareness around that. I'm not sure where that messaging is coming from, possibly from their primary care physicians, or they're seeing it, in their Facebook feed or something like that. But balance is really important. Dan, why is it important for people to focus on maintaining and improving their balance, especially as they age?
Yeah, it's a huge part of everyday life, like walking around, moving around, being able to do that safely, comfortably. A lot of our older patients we see, they still want to go out and do yard work and stuff like that. Uneven terrain, they're bending over. Not falling there is pretty important. And especially in that older population, sometimes they're getting osteoporosis or frailer bones. So when they fall, they're more likely to fracture, and then that's never good. Ending up in the hospital and getting even more deconditioned after that.
Yeah. And Nick, this is something that we really push hard with our patients, but in terms of falls, especially over the age of 65, what is kind of the story that you tell a patient to get them maybe a little bit more focused on their balance?
Sorry, Travis, I'd cut out for a second, but I believe what you're looking for is just the mortality rate. If you, unfortunately, if you fall and break your hip, this is not good for your long-term health. Your chances of dying go up quite a bit. And some of the things that we had researched, right? If you fall and fracture your hip, if you have it repaired, you still have a 21% of dying. But you have a 70% chance of dying if you actually don't get that hip fixed afterwards. So really, this is a big deal.
Yeah, there's tons more research that's coming out about this because it's becoming a bigger and bigger problem. One of those factors is our population is living longer than we used to. So if we have a population that's growing, that's living longer, then we're going to see more statistics like this. So there's a bunch of research reports. There's some that we will include in the information that we have here, but pretty consistently, if you're over the age of 65 and you fall and fracture your hip, there's really probably a 30% chance that you are going to die from that injury. Not immediately, it's not instant death, but what happens is you die from complications, or really it's more from being under-muscled. So think about this. Think about if you are not above 65, think about someone that is above 65. Chances are they're probably not as active as they used to be when they were younger. And if you're not active, you're going to lose muscle mass. So they don't pass away from that injury immediately. That is super rare. But what happens is they're so under-muscled that it's almost impossible for them to recover from that. And we tell the mortality rate, like the chances of you dying in the next 365 days, is between 30 and 40% to kind of catch the attention. But maybe the more alarming one is if you are in the same situation, you have a less than 50% chance of ever returning home. That one is the one that kind of grabs me. So it's like, wait a second, what do you mean not returning home? You are in such poor condition to begin with that you survived the injury, yes, but it's never safe for you to live independently anymore. If you have a house with stairs, if you want to drive and do your grocery shopping, do a community ambulation, there's a large percentage of people that as soon as they fracture their hip, they will not return to that stuff. And a lot of times with our patients, I think a lot of people think, oh, that's people that are like close to 100, or that's the people that are, they were in terrible, they never got, they were in wheelchairs. I think that's the idea that they get. I'm telling you right now, like everyone on this call has seen someone who was like doing everything they wanted to do, and they seemed to be apparently fine, and their balance wasn't that great. And they have a fracture, and their life completely changes. Like they cannot recover from that injury to live independently at home. So they are either going to pass away from that injury, or they are going to be in some kind of assisted care type situation where they lose their independence. And that, I think, is tough, because what happens after that is if you have an injury, you can't do the things you want to do. It's kind of a failure to thrive thing. I mean, it's if I can't do the things that I want to do with my friends and my family, it's like, what's the point? Like, why am I here? And they kind of lose that fight to kind of keep going. So Dan, what are your thoughts on, and some of this will be very straightforward, but why do people lose their balance or decrease their balance as they get older?
Yeah, so there's definitely like things you have less control over, like circulation, stuff like that to the legs, but mainly people stop doing like activities that really challenge their balance, more dynamic activities, like sports or hiking, stuff where you're getting that balance practice, even though you're not like thinking of it like that. Losing strength in the lower legs, strength's a huge component of balance. So yeah, they're just not doing as many dynamic things that challenge their balance and keep it functioning well.
Yeah, so we talked about this before in our other podcast, just kind of narrowing your activity level. It's just, well, I'm older. If I have an opportunity, I'm going to take the elevator instead of take the stairs, or, I'm going to get a handicap parking spot so I don't have to walk so far when I'm at the grocery store, or just really kind of narrowing their activity level. Your score, Nick, in terms of what does that mean? Again, pretty straightforward. I mean, the worse your score is, what is going to happen?
Higher risk of falls, higher risk of everything we just talked about, not returning home, I mean, injury, etc.
Yeah. So again, like we talked about, this is a skill that you can work on. It's not something that you just lose as you get older. You will lose it as you get older if you don't do anything about it, but there are things that you can do. So speaking about the things that you can do, based on your score on the test, Dan has written out the programming for you to improve your balance. So what does that look like, Dan?
Yeah, for the lowest score categories, like I said, strength's a huge component of balance. So just some basic lower extremity strengthening stuff like squats, deadlifts, bridges. That'll help at the lowest level. And then just actual like balance practice, kind of doing the test, standing on one leg. And then like that's pretty easy. Then you're adding in like either closing your eyes, standing on different surfaces. You can add in reaches with the arms or leg swings just to make it more dynamic and make your body have to react and correct.
Right. So just challenging your balance. Again, not super complicated stuff, but it is super effective if you work on it. And final push here, Nick, sales pitch for someone who might be out there, be like, yeah, my balance isn't as good as it used to be, but I don't know. I haven't had any falls and I can get around and do everything I pretty much want to do. What is that message that you would tell someone to try to get them to focus in on their balance a little bit more?
My message actually, as we're talking here, try this test. That's actually the message, because the amount of patients that I'm going to say, like, or even just that I've had in their like 40s and 50s, like, why are you having me try and stand on one foot? Of course I can do that. They lift their foot and they immediately set it back down within about 3 seconds because they cannot hold it any longer than that. So my message really is, no matter what your age, try the test. I think that's the biggest thing that's going to tell you a lot of information about yourself.
Yeah, I think that's great. I have the same situation, right? The patient picks their foot up and goes back down. Like, wait, give me, I want another shot at this. And then
Yeah.
they do the same thing. And they're like, wow, my balance is not that good. And then we go with, okay, well, really what we expect is at least at a minimum, anybody, no matter what age or what condition they're in. Now, if they have an orthopedic injury that doesn't allow them to stand on one foot, that might be a barrier. But if that's not the case, you should be able to hold your single limb stance for at least 30 seconds. And there's research out there that shows if you're less than 30 seconds, then you're going to be at a higher risk of falls. So we just want to try to prevent these kinds of issues on the front end. So Dan, anything to wrap up on with balance?
No, I think we covered it.
Pretty straightforward. One of the more researched movements in the program that we have. So there'll be tons of data that we can show you if you guys like to read the research. But yeah, that is balance. Work on it. Do the test. I think that was really good advice from Nick. Just do the test, no matter how old you are or how young you are. Just try to do the test and see what that information gives you. All right, guys. Thanks. Here's to better health through better understanding. See you soon.